Ladies and gentlemen, enjoy the Leeds experience.
Everybody's had smiles on their faces. Lots of energy and interesting things to do, to see, to learn about.
I think it's brilliant that we're talking about values today.
It's much more about getting people together and valuing everyone for what they can do, what they're interested in.
First of all, this is about delivering better services for patients. It's about listening, it's about engaging, it's about empowering, and it's about giving away some of that professional power we hang on to.
This summit is a really important part of bringing people together to set out the direction for the future. But that, in a sense, is only the beginning.
What we really wanted to do is to take a city and showcase the great work that's done all over the city, celebrating the way that people change lives. People change lives from lots of different communities, and great stuff. There's no name for dementia in the 5 main South Asian languages, so we use memories as a tool to get in.
Over the last few years, we've been developing human rights-based approaches for people with learning disabilities and mental health problems.
Interactive is a project that brings different kids together from different races.
Time to Change is a mental health campaign that's nationwide, that's tackling the stigma towards mental health.
A fantastic team here, people who have got experience in supporting people through addiction, preventing suicide in prisons, working with people around post-traumatic stress issues.
And what we're doing is promoting independence and well-being for people in the early stages of dementia.
Today we're taking pledges from people. The photo pledge of their support for the campaign allows us a visual representation of the amount of people that support us.
So it's practical ways that service users can use the Human Rights Act to make a difference to their lives and make it real to them. And the key to this is co-production of working with service users in partnership with clinical staff.
It's much more about collaborating as equals than the support that helps them.
It's a crucial opportunity for us to shout about the work that we do, because quite often you're so involved with actually delivering the work that you don't get a chance to share.
It's a strong combination of NHS professional expertise and patient expertise.
These young people who would not normally cross their paths become friends, become healthy in their lifestyles, focus on their education.
I think the event's been really important because it's enabled us to demonstrate how we work and demonstrate a sense of the equality of what is needed for people to become involved in their society.
And we really feel like today we've met some quite influential people who might in the future think about the sorts of work that we do when they're commissioning services.
The best bit of the day was learning to line dance with those wonderful older people. You know, they were telling me about this new energy they've got for coming together, for learning together, and how now they're not at the GP every week actually. What they're doing every week is meeting up to learn how to line dance. Fantastic.
I'm 22, next year I'll be qualified, but I don't have those diverse backgrounds that people have. The best way I can treat my patients is by hearing their experiences, otherwise I'm not going to know.
When I hear people like you talk, I actually get filled with that.
Are you Superman? Oh my god. I just feel a bit unappreciated.
We are the NHS. I think we know a thing or two about unappreciated. Superman, this is a room that understands you.
Come on, Superman. Come on, you're a champion. Come on.
Well, today's been a tremendous experience. I'm absolutely inspired by the people who have been doing such great work in Leeds, in the north of England and across England generally.
People are already doing fantastic things, so today was about discovering that and sharing that.
From what I've seen, there's lots of fantastic stuff going on, so presumably the voluntary organisations are sharing what they do, and there are some big cheeses from the NHS who actually seem to be listening to that and also valuing what's going on.
What they've given to me is a sense of meaning to the policy work that I do. I don't feel it's shuffling papers across desks. I feel it's bringing the personal fair diverse champion movement alive. It makes me work harder and smarter.
I think today's been better than I expected it to be, to be perfectly honest. I'm going away with a big smile.
The energy's been wonderful, and that's what we were looking for.
Great engagement today. People have come away inspired, enthused, and with a real can-do attitude.
Today for me is the start of a new chapter that's going to really make a difference to our local communities and to the NHS.
What I want is people to say, I remember that day in Leeds and this is what you said, so that actually we can never forget the kind of commitments we've made today.
For people who haven't been able to be here, if something comes to your town, get yourself along to it as well with it.